in Texas. That's not just a number. It means lives saved, families intact, and a community that's learning how to keep each other safe. There's still a long road ahead for us, but today we can say this. The city of Austin and Travis County are no longer reacting to a crisis. We are building a system that prevents it. I'll now pass it along to the Austin Public Health Medical Director, Dr. Desmar Walks, to say a few more words.
Thank you, Mayor Watson. The projects you have mentioned have been successful and investments are making a difference. Hello, everyone. My name is Dr. Desmar Walks. I'm APH's Medical Director and the Austin Travis County Health Authority. Last year, I said that anyone could be the victim of an overdose and that we needed to provide a coordinated, community-wide response to address this crisis. Today, I can say we've made real progress. Austin is now seeing a decline in drug overdose deaths. We have created an opioid resource dashboard on our website at austintexas.gov/opioids, and this makes overdose data and recovery resources easy to access. We've also published an opioid overdose surveillance report to better understand who is being affected and how we can respond. The story we've seen time and time again through our work and research is that anyone can be a victim of an overdose. This epidemic has found its way into all parts of our community, but with continued support and collaboration, we can push those numbers even lower and save more lives. I'd like to go over some tips for anyone who's listening today on ways that you can prevent an overdose. Never use drugs alone or behind a locked door. Let others know if you have naloxone, especially those around you. Learn the signs of overdose, pinpoint pupils, reduced alertness, and slow or absent breathing. If someone shows signs of an overdose, even if you're unsure, administer naloxone. Start basic life support and call 911. Remember, opioids can last longer than naloxone, so continued critical care is critical. We've partnered with UT Center for Health Communications to create the In Austin, We Keep Each Other Safe campaign to share critical information on carrying naloxone. And here you see some of those posters as examples. This campaign delivered 56 million impressions and drove more than 58,000 visits to the campaign website. While this one-time funding comes to a close, the City of Austin will continue to support harm reduction, peer support, naloxone training and distribution, healthcare provider training, and media and communication strategies leveraging opioid abatement funds. Through a coordinated, multi-sector approach, we will continue the progress towards our goal of ending overdose deaths. I'd like to now pass this along to Austin Travis County's EMS Chief, Robert Lucas.
Good afternoon. Robert Lukritz, the Chief of Austin Travis County EMS. Very excited to be here today to be able to celebrate this one-year anniversary and all of the great accomplishments that we've seen across Austin and Travis County. For the background, back in 2023, the Austin Travis County EMS Department worked with our public safety and public health partners to develop the Breathe Now program, which was an opportunity for us to develop a program to educate and train individuals in the public on how to recognize an overdose, how to administer Narcan or naloxone, so the same thing, and care for someone until help arrives. The program was great. We realized that it needed to grow, and we were so excited last year when we understood and found out that we'd received the grant and were able to partner with the Austin Public Health Department to expand the program. It was particularly poignant about a year ago because at the same time we were announcing this grant, we also had a very tragic and sad day here in the city of Austin, where in one day, an outbreak in overdoses resulted in 79 overdoses with 9 dead, 9 fatalities. While the work of our community health paramedics to rapidly deploy that morning to distribute Narcan and other resources to those most in need, it highlighted the need for us to get ahead of this and for us to empower the community to be able to do this on their own and to care for one another. And that's why programs like this are so critical. As was mentioned, since then, we've trained more than 1,100 people in Breathe Now to recognize an overdose and administer care. We've also distributed more than 24,000 doses of naloxone or Narcan. And it's not just to the residents and patients that we see. The distribution of naloxone in our partnership with the Austin Public Health Department is a partnership with the community, with local businesses and housing communities to allow them to have resources such as Narcan and to train them in Breathe Now, because we know that these things happen in all sorts of venues. And we're carrying naloxone on every ambulance, every fire truck, and every police car here in the city of Austin so that we can distribute them to individuals in need. We spoke to you not long ago, and as was mentioned earlier, we know this is working as we're seeing a decrease in overdose deaths in Travis County. We've proven that adequate training and access to Narcan saves lives and can turn the tide on the epidemic that we're seeing, not just here in Austin and Travis County, but across the country. Speaking of across the country, cities across the nation have recognized that the work we are doing here with our city partners, with Austin Public Health, Austin Travis County EMS, as a national model. And we continue to work with other cities across the nation to replicate the resources and the programs that we've developed here in Austin. It proves, truly, what we can do when we work together as a community, as a city, and as a county, and with our community partners in harm reduction. And with that, I believe I'm turning it over to Judge Andy Brown.
Yeah, good. Thanks.
Good job. Thank you.
Good afternoon. I'm Travis County Judge Andy Brown. Great to be with y'all today. En el último año, nuestra comunidad ha logrado avances significativos en la lucha contra la crisis de opioides. Gracias al trabajo conjunto con organizaciones locales, brindamos apoyo directo a cientos de personas. Capacitamos a casi 600 profesionales de la salud y logramos reducir en un 22% las muertes relacionadas con opioides, incluyendo una disminución del 36% en muertos por fentanil. Estoy orgulloso del compromiso de nuestra comunidad y seguiremos invirtiendo en estrategias basadas en empatía, datos y colaboración para salvar vidas. When we gathered here last year, I said we needed to meet people where they are, with empathy, resources, and a path forward, because everybody deserves dignity, safety, and support. Over the past year, that's exactly what our community has done. With support from the Texas Harm Reduction Alliance, we brought on 6 peer coaches who offer direct one-on-one support to more than 100 people. Nearly all of them made meaningful progress towards goals like housing, recovery, reconnecting with loved ones, or staying connected to peer support. Inside of the Travis County Jail, the Texas Harm Reduction Alliance, Maggie's here today, hosted over 50 harm reduction group sessions with nearly 600 participants. Because when people leave jail, they need more than freedom. They need preparation, support, and tools to stay healthy. We also met people at one of their most vulnerable points, right as they were leaving incarceration and facing homelessness. Our teams conducted nearly 300 coordinated assessments and made more than 400 referrals to healthcare, housing, and treatment services. Through our partnership with Communities for Recovery, 4 peer specialists provided ongoing support to more than 50 people, while more than 2,000 people attended peer-led events and groups. Over 200 of them were engaging in recovery activities for the very first time. And that's how you build a recovery-friendly community, one conversation, one connection at a time. We also invested in training the medical professionals who are often the first point of contact. UT's Pharmacy Addiction Research and Medicine program developed 2 new continuing education courses for providers treating patients with opioid use disorder. Nearly 600 healthcare professionals completed the training, and 70% of them reported feeling more confident talking with patients about opioid use. Many of them are now incorporating harm reduction into their daily practice. All of this is making a measurable difference. As you've heard before, Travis County has seen a 22% decrease in overall opioid-related deaths in 2024, down from 486 to 380. And even more notably, fentanyl-related deaths dropped 36% from 279 in 2023 to 179 in 2024. Over the past 4 years, we've allocated $4.8 million in local and federal funds to combat opioids and overdose rates. In April, we received another $1.4 million to our opioid abatement fund to sustain and expand this momentum. We've deepened our commitment to meeting people where they are. And that includes partnerships with Austin Travis County EMS teams that you heard from a second ago through the Opioid Use Disorder Support Program, on-site treatment for opioid withdrawal through the buprenorphine bridge. Mayor, I have trouble with that one. Program, expanded overdose awareness, Narcan training programs, and collaborations with school districts, public health departments, and local organizations. Everybody knows somebody affected by this crisis. A child, a friend, a parent, a loved one. Far too many families here in Travis County have already felt the pain, and we're doing this to reduce that in the future. And while we're making real progress here in Travis County, it's frustrating to see state leadership continue to block simple, life-saving tools like fentanyl test strips. Our Lieutenant Governor Dan Patrick refused to pass fentanyl test strips through the legislature once again, even though they could prevent countless deaths in Travis County and across the country. Yet he's insistent on banning THC and hemp products from people who need it, like veterans. Let's be clear. Test strips save lives. Fear-mongering and misinformation don't. That's why we're continuing to advocate for smart policy, expanded treatment access, and broader distribution of life-saving tools like Narcan or naloxone. This work is far from over, but it's proof that when we invest in the right strategies and work together, we save lives. I want to express my sincere gratitude to the City of Austin, to our mayor, to our Travis County staff, our first responders and healthcare workers, and THRA and other community organizations. This decrease is just the beginning, I hope. Together, we're building a stronger foundation rooted in compassion, data, and a commitment to ensuring every member of our community has access to the resources they need to survive and thrive. Thank you very much.
Well, thank you, Judge Brown, and thanks for all the work that you've done and the county's done. As I said a moment ago, and it bears repeating now that you've heard the presentations from these folks, we are no longer in Austin and Travis County reacting to a crisis. We are building a system that prevents it. I want to say again, thank you to Congressman Lloyd Doggett for the role that he played in getting us money that we have put to, I think, very, very good use. And also I want to say thank you to the community organizations that have made such a difference. And with that, we'll answer a couple of questions.
Mayor, I think the judge talked about it, but can you or the judge talk about how this will continue in the future without funding and in times of reduced state and federal funding?
Sure, and we'll call on a couple of people. You want to start, and I'll follow up after
I mean,
you?
so thankfully we're getting money regularly from the opioid settlement. So we just got that $1.4 million that the county got. I think the city gets similar amounts. The state, Central Health, I get that is ongoing and does not depend on federal funding. We of course have our local revenue that we get from local property taxes. That is not being cut by the federal government last time I checked. And so, this is the number one cause of accidental death in Travis County, even though the numbers have gone down. And so it's something that we have to invest in. We have to make these improvements to our public health and continue fighting no matter what the federal government does.
And the only thing, that's a really, really good answer. The only thing I would add to it is that we're winning, and we're going to continue to do what we need to do to make sure that we like I say, we're building the infrastructure. We're not reacting anymore to a crisis. So we need to continue that process. Yes.
Have you seen any? Oh, sorry.
So just to put a finer point on it, like without federal support, do you feel that you have adequate funding to achieve your current goals on this issue?
I do, and I think one of the things and I think we will continue to make sure that we do. I think the answer is that simple. Yes, sir.
Yeah, and just to follow up on that, are you reaching out to congressional members, people at the federal level to try to continue to get funding this?
It feels like on a daily basis I'm reaching out to the members of Congress on the different things related to the budget and what needs to happen. So, but yes, we have a good story to tell here, and as the chief mentioned, the rest of the country is also looking at how well things are going here. So we have a good story to tell, and I think you'll hear us continue to tell that. Do you want to add anything to that? Okay.
Just one more, just going forward, what does the strategy look like? Is it just more of the same, or are there additional programs or strategies you'd like to try that you haven't already?
I'll let her, doctor, answer that.
Well, we are continuing the programs that we're using now that are part of the CDC evidence-based protocols that have been successful to date. We're also looking continually and doing after-action reviews of what it is we have done, where there are gaps, and we'll continue to do that. And we're also going to be mentioning and messaging, to parents to have them talk to their kids about drug use and not using drugs, and continuing that messaging so that we can stop the beginnings of that. And we're, as a community, working to bring people back into community. Many conversations that I've had with Maggie Luna, with THRA, there's a separation from community and isolation that comes with addiction, and so working together as a group across all parts of this system are going to be essential for us to continue to see this success.
Chief, you want to add anything?
From an EMS perspective, what we've recognized is that Narcan and naloxone, it absolutely saves lives, but in some ways it's a little bit of a stopgap, because the only way that we're truly going to overcome this epidemic that we have is through long-term care and treatment options. When we rolled out this program and when we first started distributing Narcan, we recognized that folks that administer Narcan, while they are saving their lives, if we can't get them from there into another program, there's a high propensity that it will happen again, and it will happen again. And so one of the things that we have done is, in recognizing that, is we follow up with every single opiate overdose here in the city of Austin and Travis County, and try to identify and try to locate the individual, the patient, and work with them through our, as the judge mentioned, our buprenorphine bridge program. Even I have trouble with that. The buprenorphine bridge program, where we're able to administer medication with them on a bridge while we work to get them into long-term treatment. And we have a phenomenal success rate for those individuals that want to get treatment. Going through our program, being able to place them into that care. So I think it's programs like that. We can't stop with just Narcan. It has to be partnerships with the community. It has to be partnerships with the state and other entities, because this is a much broader and larger problem than just here in the city of Austin.
Sure, please, yeah.
I can't resist. So one other thing that I think we need to do is, so the mayor and I and city council and commissioners court have been working on getting a mental health diversion center system set up here in Travis County. We're already doing a pilot along with Central Health, the city, and the county. But this is something today we've got, 2,300 people in the county jail. Somewhere around half of those folks, maybe more, have a significant unmet mental health need. This often leads to interactions with police, and we don't have enough assets for people who need that mental health help. And often mental health and substance use disorder are co-occurring. So I'm hopeful. I think we have funding paths for it to establish a mental health diversion center, a local psychiatric hospital that will help us immensely in this regard, because of all the co-occurrence between mental health needs and substance use disorder.
Judge, will the efforts at the harm reduction all sit in the jail, will that continue in year 2? Or?
I hope so, Maggie.
Yes,
Yep.
we did. Can I say
Come on, sure. Yeah.
We were planning on expanding our reentry efforts, but we lost a Bureau of Justice grant, so we're just doing what we can with what we have right now. And so we have 2 people that go inside of the jail. We would love to expand that to 4, which is, we have a plan for it. So, but yes, that's exactly where people are being met where they are, and learning about the overdose crisis when they get out and how dangerous it is.
Good answer. All right, anything else?
What is the wait time like now to get
Oh.
into treatment?
I don't. We'll have to get you an answer on that. You know? 1 to 4 days.
Generally, it's under 7.
Did you get that?
That's for buprenorphine, right? But like into actual like long-term
All
treatment.
treatment, we typically have people in within 4 to 7 days.
Good.
Let me ask you a question on a different topic.
Sure.
This, the ICE events that have been taking place, the protests last night, and any upcoming protests. Just your feedback on that.
Well, I guess what I would say is that this is a very real situation impacting the lives of real people. What's going on, and I recognize. I want to be very clear about that I recognize the value and the humanity of our immigrant community, and much of what we're seeing in Washington is meant to create fear. It's meant to create chaos. It's meant to get attention, even if that's negative attention. Some people want to refer to this as an insurrection. Well, they want it to look like an insurrection. They want manufactured violence and they want manufactured chaos. And so one of the things I would say is I'm not going to play into the politics of fear. I'm going to work, as I have been for months now, to reduce and mitigate the fear that many people in this community are feeling. I also want to say that I'm supportive of peaceful protests against the policies that people disagree with. I support their ability to assemble peacefully. I support their right to assemble that way and their right to speak out against things that they disagree with. But I also want to say that destructive actions or efforts to hurt police officers is wrong. When people do that, you're damaging your city. And plus, I think it plays into the politics of fear and chaos. It doesn't help those being targeted, and it actually gives power or empowers those who want more power and want to create more pain and want to create some destruction. So one of the things I would say is protest. If you want to protest, you have a right to do that. Protest. Speak out. But don't become a tool of the chaos. Don't become a tool of the fear or the negative activity. And don't be a player in someone else's theater production like what you're seeing. So.
Are you concerned that I think 4 officers were injured last night?
Sure.
Troopers deployed tear gas. Are you concerned that this might continue or escalate tonight?
Well, that's part of what I'm saying right now is I support and want people to feel comfortable in their city, in Austin, Texas, being able to express their point of view, be able to assemble, be able to gather and express that point of view and protest things that they don't agree with. But don't be destructive. Don't try to hurt police officers. That damages your city, and it plays into the hands of those who are trying to create theater and create chaos. Thank you all very much. We appreciate you being here.
Thank you.
And we have an EMS demonstration outside, so when you're ready, we are able to get that to provide
You don't make it easy.
We say butte.
Say what?
We say butte.
Well, and
buprenorphine.
he stands up and reminds me it's Narcan.
Yeah.
I can say Narcan.
Yeah.
Right?
Narcan. I appreciate y'all.
Thank you.